The next step is tree of thought prompting. Tree of thought prompting means that it again builds on what we did in the previous one, that is the chain of thought and multiple reasoning pathways simultaneously. For example, in case of here in jaundice, we think of hemolytic, we think of neonatal hemolytic jaundice, and whether it is there is a stone in the gallbladder, we think of the HB, different kinds of defective hemothalassemia, etc., etc. We can just think of with the jaundice, three types of jaundice. And here, what happens that this approach mirrors how clinicians they consider the diagnostic possibilities and evaluate the evidence before reaching a conclusion. It is just similar to how everyone thinks. And we have given it more and more data. So, and here even complex cases can be uh, looked upon. So we'll just give it the prompt. So list three possible diagnoses for a patient presenting with jaundice. Explain the pathophysiology and distinguishing feature of each uh, briefly, and select the most likely diagnosed based on these additional findings, that is fever, right upper quadrant pain, and recent history of gallstones. So let's see, we have given it uh, multiple possibilities. Rather, we have given it the case history of the patient and also asked it to produce three possible diagnoses. A tree of thoughts. So let's see. Acute viral hepatitis, its possibilities, pathophysiology, and choledocholithiasis, acute cholangitis, then interpretation of additional findings. The patient has fever, the right upper quadrant pain, and recent gallstones. It strongly suggests of cholangitis. And most likely diagnosis is acute cholangitis. Rationale: the presence of Charcot striate, that is fever, right upper quadrant pain, jaundice, and history of gallstone points clearly to biliary tract infection due to obstruction, that is cholangitis. And we can even create the OSCE vignette or infographic. I'll just show you an example of an infographic. You can write your questions in the chat box, questions, comments, or I can unmute you also if you want to ask a question, just raise your hand. There was a lot of disturbance coming, so I had to mute everyone. So it's creating a flashcard, which you can just take a printout. And this you can distribute to your students or make a poster, etc., whatever you want. I have unmuted everyone. So if you want at this stage, if anyone wants something, you can ask. So next is, so we were on tree of thought prompting.